Critique on the video Microbiology, Bacteria Antibiotic Resistance by Armando Hasudungan. The critique is by Armani Willis for the sake of a homework assignment. The antibiotic, the mechanism of action for antibiotics is that it is a chemical that most of these chemicals target gram-positive bacteria, which includes both cell wall and cell membrane. Most of these antibiotics disrupt either cell wall or cell membrane, thus creating a disruption in the osmotic pressure of the cell, allowing its contents to seep out of the cell and thus destroying the cell. Some antibiotics target the nucleus specifically, or the DNA inside the nucleus, disrupting the ribosomes in their production of proteins for the healthy function of the cell, or disrupting the DNA itself. There are various ways of creating resistance to these effects, which includes building a pump that extracts the antibiotic substance specifically from the cell before it can build the pressures to cause the disruptions in osmotic pressures. The buildup of population in a cell body system is given by the standard rate of formation as a function of time. The amount present is equal to the original amount, E raised to the rate of growth times the time. This is an exponential function. When an antibiotic invades and causes disruption of the production of A1, the remainder is Q, right? This is constant or relative in an antibiotic. In the case of an antibiotic, when a probiotic is introduced, A2, the offending bacteria minus A2 is given by the remaining amount Q as a function of time. As a function of time. This means that the rate is actually negative as time is positive. So when the antibiotic destroys everything and removes at a linear rate, what is left over, Q, is allowed to build up as if nothing had happened. So if the offending bacteria is still there, or still may have a chance to develop the way it originally developed, it may grow. Such is the case most of the time, since most of the antibiotics do not target the source of the infection, whereas A2 more directly targets the source of the infection in the disruption of the rate of growth of A1. So since the rate of growth of A1 is being minimalized, it is a direct affront to the source environment by occupying the source environment at a growing concentration similar to A1's concentration. The antibiotic can directly argue with A1 and reduce its population to zero. Not only that, but continue at a steady rate given by the sinusoidal function for as long as it has the ability to gain nutrients for its own body. So in any given situation where a population is being grown offensive to the environment, it is not frugal to use an antibiotic and get a steady rate Q that can easily build up, since the Q is actually a complex exponential function that can grow at a rate similar to its previous rate. We use A2 to get the rate of A1 to be negative, right? So that Q will approach zero. This goes for bacterial conditions, and it also goes for society and works in civilizations as well. Thank you for hearing this presentation. That is all. Goodbye.